Good morning, ladies and gentlemen. Welcome back once again to the Weekend Wellness Workshop. I'm Dr. Dennis Courtney with you today with a weekly message on something new, something interesting, something you more than likely have never heard before that absolutely plays a major role in my practice and ends up allowing me to achieve optimization in how you're feeling and giving you the opportunity to achieve longevity with quality. Now, dating back to the earliest days when we started this show, I can remember spending an entire show talking about what I referred to at the time as the plan. Now, the plan is my plan. It's the plan I use to pursue and help all patients that I ultimately meet. And as I told you back then, and as I re-emphasize today, the plan consists of three components. And no matter who it is or what it is that I'm going to be treating, I'm ending up following a pattern of pursuing these three avenues of pursuit, at least as the starting point in every single case. Now, to refresh you on what the three steps were, they were, number one, to correct, after I find out, all of your deficiency states. And certainly over the course of time, you've lacked in your diet what it has been lacking in, and you enjoyed the foods that you enjoyed, and you missed the nutrients that you missed. And so now here you are at 30, 40, 50, 60 years old, and the lack of those nutrients is finally weighing in on the diseases and the maladies of your advancing years. We have to correct deficiencies, and we certainly do elaborate things to go ahead and accomplish that. Number two, along with correcting your deficiencies, we must determine and correct all of your toxicities. Now, you've equally accrued these toxicities over time. You are a Western Pennsylvania, you're a Pittsburgher, and although things aren't as ugly and dirty as they once were in the past here in Western Pennsylvania, they still are not, we're not out of the woods, so to speak. We still have a high pollution area here, and you have soaked up all sorts of toxic substances over a lifetime, and they too are interfering with the ability of tissue to function well. Consequently, they must be removed, and we take a lot of pride in finding out what they are and how to remove them. Now, these first two components, I find that no matter who the alternative practitioner is, and no matter what specialty he represents, I mean, it could be a chiropractor, could be a naturopath, could be a medical doctor or an osteopath, could be a homeopathist. It doesn't matter. I feel that these first two of deficiencies and toxicities are never ignored. They're always picked up on by the clinician in mind. The third component, I find, is always missed. I mean to tell you, I don't find, even in my colleagues who I consider very close friends of mine and co-equals in terms of practicing, I find they're absent in this. And I find it to be inexcusable as to why, but let me just tell you, the third component of the plan of three happens to deal with your perfusion. Perfusion is a pretty fancy way of saying the obvious. A blood flow, a very adequate blood flow, needs to exist to every area of your body in its most maximum and optimum way. Because if you have no blood flowing into a certain region or a group of cells or a cluster of cells, then those cells, number one, are never going to be able to get the nutrients that you want to provide them, no matter how healthy a diet and supplemental regime that you're on. And number two, whatever toxic substances may be locked in there, you're never going to get them out unless they have a conduit or way for them to egress. And unless you optimize somebody's perfusion, you can't ever, in my opinion, ever correct the deficiency states and the toxicity states that everybody seems to be so much aware of. That perfusion is that important that it occupies a large place in my practice. And today, we're talking about perfusion. We're trying to get the message across to you. How do you improve this thing? And it turns out there are two very unique ways of doing it. The first of which, we're going to be spending this morning's first segment with Dr. Ozlem Soran talking about a unique therapy that's available that's referred to as, well, in some cases, EECP. In other cases, just plain old ECP. These letters stand for these words: enhanced external counter pulsation, or just regular external counter pulsation. This is a FDA approved and insurance covered modality that's very difficult to find in Western Pennsylvania, and is highly likely you've never heard of it. Well, you're going to be hearing of it this morning because our guest, Dr. Ozlem Soran, is connected with the University of Pittsburgh and runs the investigational unit up there at Presbyterian Hospital on the 5th floor. To get you ready for her, let's spend a little bit of time talking about ECP here to get you ready for the first segment. And then after we get done with ECP, we'll talk about the second component in my office that allows me to maximize perfusion, and that's something called the Beemer, and more about the Beemer a little later on. Let's just take external counterpulsation right now, right off the top. There is a device. We have the devices here in our McMurray office, and we have them in our McMobile office. These are these are beds which people lay on, and two components exist to ECP. Number one, as you lie in the bed, we place very large blood pressure cuffs around both extremities. One set of cuffs that goes around the calves, another large set of cuffs that goes around the thigh, and a third, not a set, but a third belt that goes around the hips and buttock region. These cuffs have inflatable bladders inside of them, and so in a very similar way, those bladders can inflate and literally squeeze and compress the extremity that they're wrapped around. The difference between these particular cuffs and the ones used doing blood pressure are, besides their enormous size, number one is the hoses that we connect to them aren't those squiggly little tubings that you see the blood pressure cuff emanate from the blood pressure cuff, and then this little bulb that gets squeezed to pump up the blood pressure cuff. In the case of ECP, these are large hoses, and these hoses connect to a compressor. When this compressor fires, there's no gradual anything. There's an immediate compression of the extremity, and so that's step one, that's point one, that's component number one. Now let's talk about component number two. Component number two consists of the EKG component in the console that, once we hook those three little leads up to your chest, makes this an EKG device, and we can monitor your heart cycle with each and every beat through the device. So when the three leads are in place and the cuffs are in place, we hit the switch. When the switch is hit, this is what happens. Every time your heart contracts, during the contraction phase of the heart, the cuffs are deflated. At the end of the contraction of the heart, just as the heart is going to begin to relax, at that moment, the machine fires. First, it fires to fill the cuffs of the calf. 50 milliseconds later, it fires to fill the cuff of the thigh, and 50 milliseconds after that, that cuff around the hips. Now, if you add up your 50s, what this means is, in just a little over 1/10 of a second, sort of a bip, all the contraction does occur, but that contraction has occurred from calf to thigh to hip, from calf to thigh to hip, from calf to thigh to hip, literally taking all the blood from below the waist and forcing it above the waist at each heart cycle. So if your heart rate is 60 times a minute, that cycling is going to occur in that fraction 60 times a minute, or 72 times a minute, whatever your pulse rate happens to be. And that means that there are going to be 60 or 72 times where that volume of blood, which is greater than 50% of your blood, is pushed up into the central circulation to a group of blood vessels that have never seen that volume of blood before. And literally are saying to themselves, what the heck is this guy doing? We have never seen this kind of blood before. And in an attempt to try to accommodate that blood, it secretes a hormone. That hormone has a name. and that hormone is called VEGF, VEGF, which stands for vascular endothelial growth factor. And under the influence of that hormone, here comes the drum roll, folks. This is why you're doing ECP. Under the influence of that hormone, you grow a brand spanking new set of blood vessels around all of your anatomical structures. Now, this was done to help you for your heart issues, but there's not a single piece of tissue in the body that isn't helped at the same time. And so what happens is we improve the capillary network of blood vessels, not honker new blood vessels, huge blood vessels. You don't grow another one of those, but you grow multitudinous, brand new capillary networks on the arterial side of the equation and are able to bring a volume of blood to portions of your body that hasn't seen that volume of blood in a long time. So if you want to improve your perfusion, to me, the easiest and fastest and greatest way to do so is not to exercise, although exercise is certainly welcome, but you can't exercise hard enough and fast enough and long enough to do what ECP will do in a 60-minute swing of time. ECP has become a big player here in my office. ECP is what today's show, at least the first part, is going to be all about. And ECP, now that you had this initial discussion out of the way, the setting has now been placed for our guest today, Dr. Ozlem Soran, who directs the EECP lab up at the University of Pittsburgh. She offers these procedures up there. I offer these procedures out here in McMurray, and if any of you have an interest to want to pursue this and learn more about it, why don't you give us a call here, 724-942-3002. That's 724-942-3002. And we'll get you scheduled to come on in and have a discussion and a consult about your whole cardiovascular status, but in particular, how it may be that ECP can step in and change your life. Now, we're going to take a short break. When we come back after the news break, we're going to be with Dr. Ozlem Soran, and you're going to learn all about the ins and outs of ECP. And then we'll come back after our interview with Dr. Soran and talk about the other component that we use here in the office known as the Beemer. Today, the discussion is perfusion. I hope you enjoy it. Be right back right after the break. The discussion today swings to the topic of what we refer to as perfusion. You know, perfusion and how to improve it plays a big role in my practice, and how I can optimize it has been a unique sidelight to what we do for a long time here. Improving perfusion, there's no better way of doing it than by utilizing a modality referred to as, or either called EECP, sometimes called ECP, but nonetheless a technique and a modality well known in medical circles. And our guest today certainly is a star, a rock star when it comes to ECP, and especially ECP in Pittsburgh. Now, she is the director of the EECP Research Lab located at UPMC at the University of Pittsburgh. She's been the chief investigator of many trials on EECP, and because of her work has allowed the insurance companies to become much more aware of and actually cover these services. She's a primary investigator for the International EECP Patient Registry. That's conducted by the University of Pittsburgh Graduate School of Public Health. Let's just say this. If it has anything to do with EECP, it will involve this very interesting and fascinating physician. Her name is Dr. Ozlem Soran. So we want to introduce her to you now. Pittsburgh is very famous for a number of things, but you didn't know it. Right under your nose, we are extremely famous for EECP, all under the guidance of Dr. Ozlem Soran. Let's say good morning and welcome, Dr. Soran. Thanks for coming aboard today.
Thank you so much, Dr. Courtney. It's a pleasure being with you.
Now, Dr. Soran, I'm pretty sure I'm going to be catching a lot of my listeners who are wondering what the heck is EECP, and we're gonna get into that. but your background and your history is quite interesting. And so I was hoping that you could spend some time sort of telling us your story on how it is that you moved into these circles of wanting to be more than just a casual observer of EECP. How did it all come about? What was it? Did you move into it intuitively, or did research push you in that direction? How did it occur?
That's an interesting story indeed. Well, it started with my father. I am a cardiologist and worked at the UPMC for more than 14 years in the capacity of Associate Professor of Medicine, Research Associate Professor of Epidemiology, and also Director of EECP Research Lab. And currently I am working at the University of Pittsburgh Heart and Vascular Institute as the Director of EECP, which is Enhanced External Consultation Lab, and also the Adjunct Associate Professor of Medicine. In EECP started with my father's coronary artery disease. He had his bypass surgery, and unfortunately all bypass arteries were blocked after bypass surgery. And I was just kind of interested in to see how we could keep him alive and also keep him in a good quality of life. Then I came across with enhanced external consultation, and this happened back in 1997, end of 96, where that nobody knew really how it works, on what type of patient population it was good to use. And that's how I got interested in. Then we received the device back in 1997 to the University of Pittsburgh UPM Medical Center and started to do research on it. And got involved with several research. We ourselves also initiated another group of investigations on EECP, especially focusing on heart failure patients. So that's how my interest started in, because bypass and stent treatments are very good treatments in certain patient populations. But in those type of treatments, we try to open up the occlusion itself. So this is a progressive disease. Even though we deal with opening up one occlusion at a time, this disease progress. So I was always interested in how we could really target the disease itself rather than by just fighting with one lesion at a time.
All right.
That's how I got involved with the EECP.
Well, certainly many in medicine, I'm probably one too. We always have our own personal epiphany, and when a family member is involved, it does bring us in to be a little more critical and experimentally ready to take on others, knowing that our loved one is not able to benefit from many of the other things that we can offer them. So I can absolutely see why your father's condition, and especially as a cardiologist as you were always looking to see how I can help him out, and this was the pathway that was laid in front of you. So as to end the intrigue, I think these letters, these initials, and these big words may be confusing our listeners. So let me ask you this. How do you describe, or can you describe, what is EECP? What do those letters stand for? And in words, can you paint a picture for our listeners so they can envision what EECP does and how it does it?
Absolutely. So EECP stands for Enhanced External Consultation, which is a kind of non-invasive treatment, like a non-invasive intra-aortic balloon pump. So what we basically do is just to improve the blood flow that goes to the heart. That's what the system does, and also lessen the burden of the heart during the relaxation phase or during the contraction phase of the heart. Now, the system itself consists of a patient bed, which is attached to a control console, and that is also attached to an air compressor unit. And the patient lays down on the bed, and the whole system is triggered by ECG. So 3 sets of cuffs wrap around the lower limb and the buttocks of the patient. And at the time of the relaxation phase of the heart, the sequential inflation of these cuffs increases the blood flow to the heart. And at the time of systole, which is the contraction phase of the heart, the simultaneous deflation of these cuffs results in systolic unloading, which means that we are basically reducing the workload in front of the heart. So we do this 1 hour per day for 35 days. So 1 hour per day for 5 times per week for 7 weeks. Again, this is a non-invasive treatment. Patients come to the hospital and then after the treatment, they can go back to their work. This is how it works.
Well, I certainly have to describe this many times myself, and so I envision a person laying on a bed with these large sets. They look like huge blood pressure cuffs, really. One set that goes around the calves, one goes around the thigh, and third, a belt that goes around the hips. These cuffs have bladders inside of them, which are inflatable, but the only difference is the blood pressure cuffs that they tend to mimic use little squiggly tubing to be inflated. These have huge hoses that connect to a compressor. When this compressor fires, doctor, these are going to fill immediately, and in a way, they take all the blood from the lower extremities and buttocks and force it upward above the waist into that central circulation. That is a massive amount of blood. Is that in any way, and that happens every cycle, so if your heart rate is like 60 times a minute, you're going to have a continual emission of that volume of blood each and every cycle. Is that harmful in any way? I think most listeners would like to know.
That is absolutely not harmful. And in fact, today more than 200,000 patients have been treated with ECP in the routine clinical practice. More than 15,000 patients have been treated with the ECP just for research purposes. So all the data shows that it is a very safe and an effective treatment. So we are within the physiologic limits, actually. Whatever we are doing is within the physiologic limits. So the major adverse events that could occur is maybe if you do not pay attention to the treatment parameters, the patient may have blisters or like bruises, some back pain, leg pain, but those are device-related, directly device-related side effects. Other than that, all the research we had done show that the side effects that is directly device-related, if you obey the indications and contraindications, which means that if you treat the appropriate patient population, then indeed it is extremely safe treatment to utilize.
You know, I often use a description of my oldest patient, because we've been doing ECP for a long time here too, and my oldest patient ever to participate in the program was 96. You got that record beat, by the way, doctor? You have anybody over 96 that you ever treated with ECP?
No, actually, we had a patient who was 93, but we never, we didn't have a 96.
All right, well, I think I'd like to remember that 96-year-old, because even for my listeners today, you know, that 96-year-old patient needed some help getting up onto the device, and we certainly assisted him. But once he was nestled up there on that bed and those cuffs were in place, he was just pleasantly smiling because he knew his days of exercising and moving blood of this type around his system was gone, and that he couldn't exercise to that level. But he also knew that while he was lying there, this blood was moving around as though he was running a Boston Marathon. And in a sense, that's really what's happening, isn't it? Blood is moving around to all body parts, every crook and cranny. And what is it doing by having such volume move into all these places? What happens?
What happens is bring us to the mechanism of action. So all the research basically showed us that more than 70 to 80% of our patients do respond to this treatment. We really didn't understand back like 15, 16 years ago how it indeed works. what was the mechanism of action, but for the last 5-6 years, many research basically showed us how it indeed works.
Let me do this. Doctor, let me do this. I think instead of interrupting you when you're in this, let me just take 1 minute, a short break, and then I want to come back and let you go uninterrupted talking about the mechanism of action, because I think that's a key ingredient to understanding. Do you mind if we take a break right here?
Absolutely not.
All right, folks. We're with Dr. Ozlem Soran. It's Pittsburgh's Dr. Oz, folks, and she is the Wizard of Oz when it comes to EECP. She's been running the EECP lab at the University of Pittsburgh. She's spending the morning with us talking about this unique modality called EECP. We're going to take a short break and come back where the doctor tells us about how it is that this thing can do the great things that it does through its mechanism of action. So be right back in a moment with Dr. Soran. Good morning, ladies and gentlemen. Welcome back once again to the Weekend Wellness Workshop. I'm Dr. Dennis Courtney, alternative practitioner in the Western Pennsylvania area for 20 years or more. Today we were talking about perfusion and how best to improve it. It will really help you, if you can do that. And there's a therapy, a modality available that can do just that in the way that, well, nothing I've ever seen can work that well. It's called EECP. We have a director of the EECP lab at the University of Pittsburgh. She does all research on EECP literally worldwide. She's our guest today. Her name is Dr. Ozlem Soran. Dr. Soran, you back with us?
Yes, I am.
Now, when I so rudely interrupted you, you were just about ready to start what I feel is a really important explanation. I didn't want to interrupt that. So you were going to be talking about the mechanisms of action for how ECP benefits you. So please go right ahead and explain that.
Sure. Now, before I explain how it works, let's talk about a little bit of what coronary artery disease is. So patients who are suffering from coronary artery disease would know that there is a blockage in their heart artery. So the treatment modalities currently is either doing a bypass surgery or putting a stent inside that artery. So which means, of course, on top of medical treatment, drug treatment. Now, with bypass surgery, which is a great treatment, but what we are doing is trying to bypass that particular occlusion. So with stent treatment, what we try to do is just to open up that particular occlusion. Now, with EECP system that we try to describe to our audience is that system itself does not try to open up that occlusion, but uses that occlusion to create collateral circulation around the heart. So it is like a tiny little arterial network around the heart. There are two ways to do this collateral circulation improvement. One of them is through arteriogenesis, which means that we all have sleeping arteries in our heart, but we cannot really open them up unless we exercise extremely heavily, like Olympic athletes. So those are the ones usually able to open up those little sleeping arteries. By using the pressure gradient between the occluded artery and the open arteries, EECP treatment open up those sleeping arteries. So this is one way of increasing the collateral circulation. The other way is just creating little tiny new arteries around the heart, which we call it in medicine as angiogenesis. So that has also been shown through lots of research that it creates growth factor levels, which in the end increases that collateral circulation and creates those little tiny arteries around the heart. As you see, EECP is using that occlusion to create that collateral circulation around the heart. So it plays a different role, a different treatment modality, which is not a replacement of bypass surgery or stent treatment, but it definitely works hand to hand to improve the clinical outcomes of our patients. So this is one mechanism of action. The second one is through neurohormones. Now, there are very good hormones for heart, but also bad hormones for our heart. When we say good hormones, it is nitric oxide, for example, which basically dilates our arteries. Our audience probably would know the patients who have coronary artery disease are very familiar with the sublingual nitro preparats that they need to take when they get the chest pain. So same thing, in our body we do have nitric oxide, NO, which we call this NO. So EECP treatment increases those good hormone levels. And then there are bad hormones, which is an example would be endothelin, which basically cause the vasoconstriction of the artery. So EECP itself decreases those bad hormone levels. As you see, it shows its second effect through the neurohormonal change. And the third mechanism of action is coming through improvement of the endothelial function. What is endothelium? Endothelium is a layer inside all of our arteries, which basically protects the artery from getting the disease. If that layer is not intact, then the plaque occurs very easily. And the things that could damage that layer could be like hypertension, smoking, diabetes. All these factors over the years damage that endothelium layer. When it is damaged, we are prone to be a coronary artery disease patient. So EECP treatment has been shown that it improves the function of endothelium, which is another mechanism of action that basically provides better clinical outcomes.
It, in my own mind, seems to be a much better way of handling the process of occluded arteries over time, because, I mean, using a way to either nail an artery open through stenting, which is certainly practiced quite a bit in this country, or going around surgically by putting bypass grafting in it, just gets around that one occlusion and doesn't deal with the whole network of blood vessels that ECP can do. I look at this as actually a much better way of handling poor perfusion to the heart, although I understand there could be some critical lesions that must be dealt with in the other way. I sort of like this new way. What do you think?
Absolutely. By using this treatment, actually, there are certain patients, again, who benefit from bypass and stents, like acute coronary syndromes, acute MI, the patients who are having heart attacks, needs to get those treatments right away, like the stenting and intervention. However, there are a group of patients who could benefit from EECP more. Think that your heart is like a garden, right? You need to water that garden to be able to get benefits out of that garden, right? So your heart muscle is your garden, actually. So your coronary arteries, think that they are the hoses. If you have one hose that basically waters the garden, and if you block that hose, the water will not be able to get enough water. The garden will not be able to get enough water, then it will die eventually. So the heart muscle, which is the garden, needs lots of little hoses that gives you the water that benefits the whole heart muscle. So that's what EECP does. It basically gets more blood into the heart muscle so that heart muscle gets what it needs in order to perform. So what are the functions of heart? It needs to pump the blood to the body, right? So if we get that, enough blood circulation into the heart muscle, we will be able to improve that function more. In fact, back in, still actually 1995, FDA approved the system for the use of coronary artery disease treatment. But it was our department we initiated all the research on heart failure patients, the patients where their heart pump function is not good enough to push enough blood to the body. So we call those patients heart failure patients. So we were the ones at the University of Pittsburgh who basically suggest that this treatment should be safe and effective in heart failure patients as well. It took several years, it took 5 years for us to do lots of research, not only the safety but also efficacy and effectiveness studies, multi-center studies, and we were able to show that EECP is a safe and effective treatment in that type of patient population as well, heart failure patients. And in 2002, FDA approved the system after all the work we had done to be used for heart failure patients as well. As you see, the perfusion effect definitely improves not only the heart function, but also since the heart basically pumps the blood to the other organs, it basically improves the perfusion throughout the body as well.
So then if I were to ask you, as I now am, who is it that should consider to do EECP? That answer would be there are two categories of patients that should consider it. Is that right?
Now, there are a group of patients who could benefit from EECP treatment. Medicare reimburses the patients who already have undergone bypass surgery or stent treatment but still suffering from angina. What is angina? Angina is the chest pain. So if the patients have already undergone bypass surgery or stent treatment, but if they are still suffering from severe chest pain, they can undergo and benefit from EECP treatment, and Medicare reimburses those patients. Patients who already have been on medical treatment, like drug treatment, but they cannot undergo bypass surgery or stent treatment due to the comorbid conditions. Those are the second type of patient population who could undergo EECP treatment. Since that you are a patient who is suffering from other disease, like severe maybe kidney problems, or severe diabetes that we cannot really operate on that patient due to the arterial conduit, which is not good enough to do operation, or to do stent, which we call those treatments as invasive approach, invasive treatment. So if the condition is bad, then those patients can also undergo EECP treatment and benefit from EECP. Now, the third group of patients are the patients who have already undergone bypass or stent but come back with reocclusion. Now, those are the patient population actually, which I am very interested in, because over the years we came to realize that there are a group of patients who are prone to reocclude after stent treatment. Say that you put a stent in, like 3 months later or 6 months later, that artery that you stented reoccludes. So you try to put another stent in, you will see within 3 months or 6 months, you will see another reocclusion. So those are the patients, in my opinion, should undergo EECP treatment because they are prone to reocclusion. If that's the case, we should give a chance to EECP treatment, which is a non-invasive treatment, instead of insisting putting like 7, 8, 9 stents in. That would be another group of patient population. And the patients who have severe diabetes are also benefiting from this treatment very, very significantly. And the fourth patient population would be patients with heart failure, especially patients who have coronary artery disease. We call them ischemic cardiomyopathy patients, but their pump function is not good enough to pump the blood out to the body. So heart failure patients are also very good candidates for this treatment. And there are also another group of patients, I would say the sixth or fifth group of patients is that patients who, like women, many women do not have major coronary artery disease, which means that their major coronary arteries are not blocked, but they do have perfusion defects in their diagnostic testing, which we call stress thallium test, for example. You will see that there is an ischemia, which means that the blood supply to the heart muscle is not good. But then you do the angiogram, their coronary arteries are clean or open. So the major problem in those patients are the small vessel disease, which causing the chest pain or the shortness of breath. So those are the patient population could also benefit from EECP.
All right, now let me do this. I'm going to take another short break. When I come back, I want to ask you, when somebody does ECP, how long does that benefit last? It looks like they benefit. How long does it last? And do you do ECP once and done, or is this repeated multiple times? I'm going to get to those questions, very important questions, on my return. We're with Dr. Ozlem Soran, the great Dr. Oz, the director of the EECP lab at the University of Pittsburgh. More on EECP on our return. We'll be right back. Good morning, ladies and gentlemen. Welcome back once again to the Weekend Wellness Workshop. I'm Dr. Dennis Courtney here with Dr. Ozlem Soran. She is the director of the EECP Research Lab at the University of Pittsburgh and has her hands all over any research that's being done worldwide on this particular modality, coming right out of the University of Pittsburgh. It's been under your nose for all these years and you didn't even know it. You're learning about EECP today, maybe for the first time, and the doctor has been talking about how it can benefit you. So, Doctor, I want to pick up with a concept that I was asking you about just before we left. When you do EECP and these nice things happen to you with the collateral circulation, how long does that last?
Now, before I get into that, let me tell you what is lasting really. What are the benefits that patients are getting from this treatment? Major things we observe is about, as I told before, about 70 to 80% of our patients respond to this treatment. And when we say respond, in the research arena, we do a lot of diagnostic testing before and after EECP, such as echocardiograms, stress tests, stress thallium tests, like myocardial perfusion imaging tests, lots of tests that we can assess the outcomes of EECP. But in the routine life, what we do, we observe the patient's symptoms before and after EECP treatment and also their quality of life. So more than 70 to 80% of patients who started with a severe chest pain or severe shortness of breath or fatigue, those patients will not have those symptoms. Most of them will not have those symptoms after the treatment. Or the severity of the chest pain will go down significantly, which definitely brings a significant improvement in their quality of life. Those are the major benefits that they will be getting from the ECP treatment. But how long this beneficial effect lasts? Because this is a 35 days of treatment, right? That's what we said.
Sure.
So all the research showed us that about 66% of our patients maintain that benefit at 3 years and 5 years follow-up. So for a non-invasive treatment, this is a very good response rate. We do not need to retreat most of the patients, but in our practice, at 1 year, the repeat EECP rate is about 13%, 1-3. As you see, that number is also very low. About 13% requires or needs to come back to get another EECP treatment at the end of 1 year. And those are the patients who have indeed severe heart failure, who have indeed severe diabetes. Their conditions are their coronary artery disease is extensive. Those are the patients who may require repeat EECP treatment, and with that repeat treatment, they get benefits out of that treatment, and we can push them up to a level that they can continue to have a very good quality of life. Our research also showed significant reduction in emergency room and hospital visits after ECP treatment. That's the research that we had done through our international ECP patient registry data, and showing that type of decrease in emergency room and hospital hospitalizations. Therefore, patients benefit out of treatment up until 5 years, because that's the time period that we follow throughout the research in that patient population, and 66% maintain that initial beneficial effect.
Those are some pretty impressive numbers, and 66% showing you they can last and get that beneficial effect of a collateral circulation for 3 to 5 years afterwards. And I did get loud and clear that this is repeatable annually if the cardiologist determines that it would be a benefit to you. So listeners out there, if you're thinking that maybe this is something that you'd like to consider, you know, I should mention, Dr. Oz, here you are. You've got your hand on every bit of, and your imprint on every bit of research done worldwide on EECP. It's coming out of the 5th floor at Presbyterian Hospital. I've done ECP for 15 years. Doctor, outside of you and I don't even know where else it's done. Do you? I mean, isn't it a little crazy that this isn't easier to find than just you and me?
That's true. There are a few other centers within the Pittsburgh and suburban areas, but again, not many patients or physicians are aware of the benefits of EECP treatment, which is heartbreaking because it is a non-invasive treatment. Its effects last long, and even if it needs to be repeated, again, it is non-invasive and safe and effective. So there are so many good beneficial effects that patients can benefit out of it, the government can benefit out of it. Therefore, it is heartbreaking to see that it is not extensively used in several other areas other than refractory angina. Of course, there are more than 800 centers, to my knowledge, within the United States, and it is spreading towards Europe as well. We need to mention that, as I think.
And with your influence, hopefully the word's going to spread to even more. I think that one of the areas very, very lightly populated with these centers, and I hope those numbers are going to grow. Now, of course, the main reason for people that are doing ECP are for the cardiovascular benefits, but I can tell you, and I'm sure you could even tell me more, of some additional benefits that patients have proudly stated that they attained from doing ECP that really had nothing to do with the heart and have been pretty amazing to them. Anything that you can recall that you want to pass on that was like a byproduct of the ECP? They got their heart dealt with, but some other great and wonderful things happened to them. What do you think some of those should and could be?
Well, there are a couple of research out there showing that ischemic stroke patients benefit from ECP.
Stroke?
Stroke, ischemic stroke patients.
Okay.
Benefit from ECP. There are some research on that, and I think it will be a very interesting area that several other young investigators could perform some more research on it. And it makes a lot of sense at my end, being a cardiologist, seeing the beneficial effects of EECP on perfusion, heart perfusion. So same thing is happening towards the brain, right? So when there is an ischemic problem going on the brain function, that also helps with that perfusion. One thing we noticed at our center and at several other centers, that cognitive function of patients improves after EECP as well. I think that's another very interesting area that young investigators should focus on their research. We have published one paper on erectile dysfunction, where many coronary artery disease patients, if you do not ask, they don't tell, but if you ask, they will admit that they do have erectile dysfunction problem. There is some beneficial effects on certain patient population with certain type of erectile dysfunction, which is directly related with the arterial dysfunction, type of erectile dysfunction. Those patients may also benefit. And there is also, to my knowledge, 1 or 2 new research data that shows the improvement in kidney function. So I think those are the areas that several young investigators could focus their research subjects.
Well, it just goes to show that there's so many far-reaching benefits having nothing to do with the heart, because really the perfusion can't be directed to benefit the heart alone. It's happening everywhere, and naturally any dysfunction going on in any group of cells anywhere in the body may be, I say maybe, affected in a positive way by doing ECP for the heart. Turns out to translate into wonderful things in other body parts, erectile dysfunction just being one of them. Now, Doctor, we're coming to the end of our hour here, and I really enjoyed having you with us today. I always like to know the fact that you're up there at the University of Pittsburgh. You're on the 5th floor, and I promised you a while back that I would make the trip up to that hill to come and see you. I do make that promise once again. I promised it won't be too much longer before I take the time and effort to come and see and meet you face to face, because now this is the 2nd radio show we've done, and I admire your work so much. Thank you for doing the job that you do, and to know that it's happening under our noses, it makes me feel really good, and maybe our listeners today will feel really good about pursuing either by seeing. Now, you normally get your referrals from UPMC doctors, cardiologists that refer to you, and then if people are out there and want to come to me, they can just call us up at my particular center. But any final words of encouragement for our listeners on ECP, Doctor?
Maybe not the final words, but if our listeners are kind of wondering why we are using this treatment for 35 days, do I have time to focus on that?
You take the time. Go ahead.
All right. So several investigators, actually, including ourselves, did a lot of research on it. Like 5 days, some people tried 5 days, 10 days, 15 days, 20 days, 50 days, 35 days, 37 days. So there's different type of treatment periods have been tried on EECP. And what has been shown that, and that's what we also observed in our practice, like more than 20 some days later, patients started to get their response to the treatment. Again, when I say response, it is the level of, or the severity, or the frequency of chest pain, shortness of breath, or the fatigue. So that response usually starts, I should say, within the 20 days of the treatment. And after 35 days, it plateaus. Mm-hmm. That's why we cut the treatment at 35 days. In some patients who have, again, extensive disease, they might be, or current smokers, they might be late responders. Those are the patients I call late responders, which means that they start responding treatment towards the very end of the 35 sessions. So they response would be like the 31st or the 32nd days of the treatment. Then they observe that increase in their energy levels, the improvement in their quality of life, or severe reduction in their chest pain. Those are the patients we may consider adding another 10 days on top of 35 days. Mm-hmm. But that patient population is very few, which I would say less than 5% to 7% of our patients may need to require additional 10 days. The rest is definitely responding to treatment within the 35 days.
35. All right, so 35 it is. If you need a little more, your doctor can decide that you can have more. And the outcome is going to make you feel a lot better for having participated. Doctor, I feel a lot better for having you participate with me today. Thank you so much for coming aboard today. Look forward to speaking with you again soon, and wish you all the best up there on top of the hill, that big, heavy hill up there going to the University of Pittsburgh. I'm going to climb that hill and meet you this year in 2016. That's my pledge. I'll talk to you then, Doctor.
Thank you so much. I appreciate it. Thank
Okay.
you. Merry Christmas. Happy holidays to everybody.
Bye now. There you have it, folks.
Bye.
Dr. Ozlem Soran. Take a short break. We'll be right back. Ladies and gentlemen, welcome back to the Wing Health Wellness Workshop. Today's topic is on the subject of perfusion, and you've just heard a pretty interesting discussion about ECP, sometimes called EECP. Don't let the additional E confuse you. One is external counterpulsation, the other is enhanced external counterpulsation. But it is a way to maximize perfusion, which is always a premium around this office because it really will help me in correcting deficiencies and toxicity states in no matter what patient I may be working with and no matter what condition we may be working on. Dr. Ozlem Soran, of course, provided a little bit of expertise coming from such a prestigious institution as the University of Pittsburgh, and known as a world-renowned researcher, to find out that she's literally in Pittsburgh, and all this is happening under your very nose, and you didn't even know about it. Now, I'm going to switch some gears because perfusion has another means by which it can be improved. So for the longest time, literally 15 years plus, we've been doing a steady diet of ECP as part of the practice, and it has carried myself and many of the patients who've undergone it in very good stead. But more recently, and by more recently I literally mean since literally the month of April to today, another modality has come my way that has been able to allow me to improve even upon how wonderful ECP has helped with improving perfusion. We're now able to absolutely even maximize that through the use of something called the Beemer. Now, folks, the Beemer is a representative of a group of modalities that collectively are referred to as PEMF devices. The PEMF stands for Pulsed Electromagnetic Fields devices. And there are many of them in the marketplace. The Beemer has been out there in the marketplace for some 15 years. I really wasn't aware of it or knew of it, but I became aware of it not too long ago, and found that this particular device is able to optimize blood flow in as little as 8 minutes, and optimize it to the point that the blood flow is literally going to go through the roof in the existing blood vessels. So if you've been paying attention to what we did the ECP for, the ECP was being done to give somebody a new set of blood vessels, a new set of collateral blood vessels, a set of blood vessels that doesn't even exist at the beginning of that therapy, and that therapy will last for 35 treatments until, as Dr. Soran said, usually by 35 treatments, the optimal results have been attained, and the treatment number can literally cease. Now, the Beemer allows me and affords me another advantage. Once we're able to give you new blood vessels through the VEGF mechanism, the vascular endothelial growth factor, that hormonal mechanism that allows for neovascularization, the revascularization through capillaries to happen. Once we have the new blood vessels, let's spend the time to optimize all the blood vessels, the older ones, the ones you already did have, and the newer ones, which are the ones that you didn't have until we just got done with the ECP. Anyways, optimize the blood flow through them all through the use of a pulsed electromagnetic fields device called the Beemer. Now, I know this sounds very sinister and wondering, oh my God, what is that? And by the way, the Beemer, not the car that you drive around, Beemer, B-E-M-E-R. That Beemer is the Beemer I'm talking about. And that Beemer is able to get an optimal amount of blood flow moving into areas of the body that literally don't have much blood flow going through them at all. And I often refer to them as crooks and crannies, because there are certain parts of the body that almost routinely become a crook or a cranny, an area that get poorly vascularized and over time lose their vasculature, and as we age, oftentimes really are the site of where diseases are going to crop up. And that's certainly one of those places, very familiar to me, doing the eye programs that we do here, is on the specific eye diseases and diseases of the retina. So using it as an example, and the reason why the Beemer actually made it into my office was because people who had retinal diseases got better quicker when we added the Beemer regime to their modalities, because the Beemer could optimize blood flow to these areas of the body. And the back of the eye, the retina in the eye, is one of those areas, and get tremendous amount of blood flowing in those regions and that weren't flowing there at the beginning of our treatment sessions. I've told you on the air, these are 3-day treatment programs, and anything that we can get optimizing you in 3 days is going to have a beneficial effect almost immediately. So now you sort of know the secret of how it is we can do our wonderful eye programs in as quick a period of time as we do. But I want to make sure that I emphasize, we may have learned about how the Beemer can be helpful with the eye programs, but we've found that there's not one single thing that the Beemer can't assist and can't improve and can't optimize in terms of perfusion. There's just not an area of the body that isn't touched by the Beemer, which, to describe a Beemer treatment, there is a lazy boy lounge chair in one of my treatment rooms, and that has a mat placed upon it. That mat is covered with a sheet, and you literally sit on the lazy boy chair for 8 minutes, and this device, this PEMF device, does its thing, and optimal blood flow is achieved before the 8 minutes is up. One final thing I want to mention to you is, after the 8-minute exposure to PEMF devices, which literally there is no contraindication for, it doesn't harm you in any way, but once exposed for 8 minutes on the Beemer, the blood flow that is optimized is then maintained for 16 hours after that treatment is over. This has led to patients who just simply wanted to purchase a Beemer, have a Beemer, and many of my patients actually do have a Beemer in their own home. So what we're going to do now is we're going to take a short break. And we're going to talk to one of my patients who stumbled across the Beemer because I recommended that they consider it, and literally has become, he's like a salesman for the Beemer. He speaks so highly of the Beemer that I felt if I was going to be doing a show on the Beemer, I'd want to have him on board. And so we're going to take a short break. We're going to come back with my guest, personal friend, guest, and patient today, who will begin to tell us about how the Beemer has changed his life and the life for he and his partner. We'll be right back in just a moment. Good morning, ladies and gentlemen. Welcome back once again to the Weekend Wellness Workshop. I'm Dr. Dennis Courtney with you on this Saturday and Sunday morning, 10 to noon. The subject this weekend is perfusion. Now, we've been talking about how it is that in my office I get to optimize the perfusion of my patients to have them recover, recuperate, reverse whatever pathological processes have been in play for however long they have been in play. And we're talking about my two go-to treatments that literally I bring up to every single patient that I ever see. Now, the first one, we've already spent quite a bit of time on this morning, and so you all know about something called ECP, which is external contrapulsation, and has been in my office for over 15 years. It has provided me with the wondrous ability to restore brand new blood vessels in patients in areas where they don't have very many vessels at all, and usually have afflictions or problems in those regions. As I mentioned before we took the break, there's been a new player, a new person on the scene, a new modality on the scene that has really livened things up and enabled me to optimize the blood flow in the vessels that we've just created and the old ones that were already there. The name of the process is called PEMF. And as you know from before our break, that stands for pulsed electromagnetic fields. The name of the device we affectionately refer to as the Beemer. And the Beemer has become very popular here. So I thought today I have a particular friend of mine, also a patient, who turns out to be, I think, one of my best salespeople. He is been a wonderful patient and has benefited from a lot of things we've been able to help him with. And he's one of the first people that jumped on the whole Beemer bandwagon. And when I thought about how to present it to my listeners, he was the first one to come to mind. So, ladies and gentlemen, let me introduce my patient, my friend, Emil, and say good morning to Emil and welcome aboard, Emil. Thanks for allowing me to invade your morning.
Oh, good morning, Dr. Courtney. It's a pleasure.
Well, Emil, here we are. I knew that whenever I wanted to discuss this on air, that you were going to be my go-to because, well, you're very articulate, you're very eloquent in your speaking, but you have suffered from so many things on your own that you're also a great test case to try anything of the new things that come my way. So let me ask you this. When I first proposed the idea of something called a Beemer, what did you think? What is it about the Beemer that may have captured your interest, or did you just go, oh my God, not another thing? How'd you take it when I said you should try riding the Beemer?
Well, Dr. Courtney, as you know, I've known you for more than 15 years as a patient, and we've become friends. And when you tell me something will do a certain thing to help my health, I don't take it with a grain of salt. I immediately thought this is something we ought to try. Rose and I decided to try it, and as you know, we opted initially here to lease the product, which you can do for 8 or 9 weeks, but we're definitely going to buy it based on our last 6 weeks. It's been wonderful. Mm-hmm.
So I guess maybe we've helped you out of some pretty rough situations, and it's very nice and very I feel honored that you described me that way on the air like this. But I guess when you've been as low as you have been with as many afflictions as you've suffered, and that you've emerged and you've come out the other end and you're doing so well, maybe I should have guessed that if I had something to offer you, you were going to try it. So, okay, I mentioned it. You tried it. Did you try it with a bit of skepticism? Did you try it fully expecting that wonderful things are going to happen? How did your first or second or third ride of the Beemer convince you that it was the right choice?
Well, oddly enough, Dr. Courtney, I have an 11-year-old, 8-month-old Scottish Terrier. And believe it or not, I put him on there alongside Rose, and I also got on the Beemer myself. We started out on the 16-minute, the second program. There's 8, 16 minutes, and 20 minutes. And we're up to the intensity level 6. But lo and behold, the first thing I noticed was after 3 weeks, the dog had been very, very hard of hearing. Wasn't responding when we called her. She started responding. She's now playing like she's 2 years younger. That mystified me. I never saw anything like that.
What a great way to promote this, because it's a dog. It's like you couldn't convince him any other way.
22 pounds. Yeah, she just sits on there, and we put her on there twice a day.
What a testimonial.
Then I noticed that my own hearing, and the reason I noticed my hearing was improving was that I noticed that the TV got loud. I had to turn the TV down about 40% on the volume on my 40%. TV. Yeah, it's quite a lot, because it was. I mean, my ears were like, "Oh, that's too loud," and Rose laughed at that. Anyway, and then to my amazement, my vision has always been pretty good, but I would analogize the improvement in vision after 6 weeks. It's like when you get a new contact lens prescription, and the sharpness, you just feel like just the sharpness of your vision has just improved. And that's what I've been getting from it. So I'm very pleased with that. I also noticed a difference. I've had fibromyalgia since having prostate cancer surgery 11 years ago. My legs just routinely hurt me every day, especially my thighs. I'm noticing a big difference in that. The machine on the box says it's for energy. I have to agree with that too, because you get on there in the morning if you get one of those mornings where you're a little bit lackadaisical about, well, I'm 67 years old. Most people my age tell me the same thing. Some days you want to be left alone. You don't feel like doing anything. You get on the machine and you feel like doing things again. So I can't say enough nice things about that machine. I'm very pleased with it. We're not going to lease it anymore. We're going to buy it.
Well, we didn't even talk about this on the airway, but it is true that many patients who have tried this felt they had to have the Beemer. And in your case, I know you had tried it a couple of times in my office, and you made the decision. And, of course, you never brought the dog to my office. That's probably the best testimonial of all. I'm happy to hear that these wonderful things are happening for you, that they're happening for your Scottish Terrier. Can you speak for Rose? Everything you mentioned, Rose, we should probably talk about her. Has she gotten any improvement from this?
She has. She has very bad fibromyalgia, and she gets muscle spasms in her legs. And one of the things about this machine that's interesting, when I first got on it for just 8 minutes at your office, I almost went to sleep. And I'm a person who during the day, I'm difficult person to put to sleep. I almost fell asleep in your office on the machine, to my amazement. And
you think it relaxed you?
Oh yeah, it relaxes. The machine relaxes you, and it's helped with her because she lost her sister about 8 years ago to lung cancer, and it's been good. And her legs, it's been helping the fibromyalgia. I'm hoping for continued improvement on that because that's a tough thing to deal with. She gets muscle spasms, as you know, doctor, and but it's been a help to the three members of the household. It really has.
My goodness, I never thought I'd get the thing with the dog. I was hoping it could help you and your partner, and so happy to hear it's happening to the family of three out there. But it's all started in the office with just riding our Beemer around here for these 8-minute rides on a low intensity level. And by the way, I guess because you're my expert, you actually know more about the higher intensity levels than I do, because all of my patients, I'm just usually getting them started on the Beemer, and you've now become a pro. So maybe you could enlighten my listeners on what that means in terms of these intensity levels, how you're able to increase as you are able to handle more, and probably discuss some things I don't even think I could. Why don't you go ahead?
Okay, doctor. I noticed that when I read the directions to the machine that it said if you have something like Rose has, like fibromyalgia, it suggested you use program 2 instead of the 8 minutes. That's the 16 minutes, twice a day basis. It has 10 intensity levels. They suggest that you move up 1 intensity level each week. That's what we've done for the last 6 weeks. And then the last 2 weeks, we opted to go to program 3, especially for Rose with her problems. And so we're using 20 minutes twice a day, and we're upping the intensity level as they suggested once per week. I have to add one other thing. Between, you mentioned EECP, the Beemer, and between that and the third one, IV chelation therapy at your office spanning the last 15 years. If you do those, I really think the Beemer is the last segment of the fountain of youth. That's what I would call it.
That's right. You did come up with that phrase, and I think that you coined something here. The fountain of youth is absolutely I've never had a modality that could stimulate improvement so rapidly until I got this Beemer. And it all started with people with their eye problems anyway, and it's just mushroomed. I think I've reached the point, I know we've joked about it, if it moves, it gets the Beemer in my office. I mean, if you just move, maybe if you sit still too long, you're going to get the Beemer because it has a universal application. So optimizing perfusion has a benefit that can be sensed immediately with the Beemer, and that didn't even happen with ECP. We should probably say, you've been doing ECP because this is a show this morning talking about all forms of how we improve perfusion in my office, and I've been doing this for 15 years as far as the ECP goes, and you've been one of those patients who were one of the initial people involved with my ECP program. So if you could maybe play a double role here, remember back to when you first did the ECP and what your situation was and how you felt the ECP device helped you way before there ever was a Beemer.
I'd be happy to, doctor. As you know, I had prostate cancer surgery, and I talked to you about it before I even did that. But anyhow, I did fine with the surgery, but I could not get any energy level. I just struggled for months after that surgery, and I just it was really making me feel old. So you suggested I get on there. At this point, I've had 75 EECP treatments, 2 different regimens of that. Most astounding thing that I didn't even expect from it, not only did it get me back on my horse and back to my law office, but it did something else. And I'm happy to say, after that surgery, one of the things that the typical male worries about is getting your sex life back. And I couldn't get it back until I was on that machine 40 times. Lo and behold, I got my sex life back, which of course put a smile on my face. That's for sure.
Oh, you know that,
to say the least. It's just it's a wonderful thing after that surgery. You know, I wasn't an old man yet. I was 56 when that happened to me.
Well, you know, we had Dr. Ozlem Soran on the show just before we cut to this segment with you, and she had mentioned in her observations of patients who she'd seen that, especially in diabetics who had erectile dysfunction, it was something that she noticed they could benefit from. And so the fact that in your own case it was helpful for you is a wonderful testimonial for men out there that are having difficulty. I'd say ECP and the Beemer both might be very important modalities to pursue. I remember those initial ECP sessions that we had. It was a number of years ago that you did your first ECP session. But the listeners would be beneficial to know that you're a pilot, and your sight and your vision as pilot's aids. This is a premium issue about how long the vision is going to last. And I'm going to ask you to harken back. Do you remember when you did not the Beemer, but the ECP for the first time? Do you remember how your vision changed? Like you saw like an eagle overnight? I almost didn't believe you.
I certainly do. I was doing ECP, and of course I've done your IV chelation program, which I highly recommend to people too. And actually, a funny thing happened. I went to get my contact lens, just buy some new contacts and get my eyes checked. And I've been going to a place on Liberty Avenue for years. They did a good exam. And the doctor said, well, okay, read the smallest line. So I started to read. And as I'm reading, he says, well, Mr. McCrory, what are you reading? And I said, well, you told me to read the smallest line. He said, you're reading the bottom line? I said, yeah, you told me to read that. He said, I have to get up. Nobody ever reads that. I don't know whether you're right or not. So he gets up and he comes back and looks at me. He said, you missed one on the 2010 line.
Oh, my
so I said, look, I'll take it, Doc. He said, I don't know what you've been doing, but keep on doing it. So I was just very pleased with that because I've been a pilot at this point for 46 years privately, and there's nothing like it. If you're landing an airplane at night in the rain, a little bit of difference in your vision is enough to kill you some days. So you need the sharpness. I'm very happy about the sharpness in that in my hearing. I can't tell you. At 67.5 years old, I feel that anything that puts you in a better position than you were the day before is a wonderful thing. Because usually at my age, all you look forward to is this is as good as you're ever going to be. You're going to go downhill. Your programs have turned that around for me substantially.
Well, you are like the epitome of people who can benefit from the whole cardiovascular. We do such a cardiovascular. We follow the whole milieu here. We're so invested in getting your cardiovascular system turned around that this perfusion aspect of our cardiovascular program is just 1/4 of it. Really, there's so many other things to do, but it's a very important part. And when you think that people actually do ECP, I've had them come in who they were taking nitro like 5 and 6 times a day, nitroglycerin under their tongue, and getting tremendous chest pains. And now when that happens, when somebody comes in, I say, you know what, you're going to start doing this little ECP device over here, and you're not going to stop until the chest pain goes. And I've never had a case where I wasn't able to get the chest pain to go completely. And I just thought I might add that because vision is one thing, and it's certainly nice to be a sharpshooter-style pilot, but just walking the earth and having so much pain and discomfort from chest pain would be something completely different. So the nuances of life that make this so wonderful, I'm glad to see it's restored in you. It's certainly able to take people with much more severe issues and get them turned around. I look at ECP and now the Beemer as the 1-2 go-to punch that I think are going to be able to maybe take me the rest of the way. If a third device comes along or a third modality, I'll be ready to accept it. But I think with these two alone, I'm going to be a happy doctor for quite some time.
I agree with you, Doctor. I want to tell you one other thing, that when I was doing EECP the second time around, there was a gentleman, 69 years of age. We were talking because, as you know, you stay on the machine for an hour. And I asked him why he was there, and he said, oh, I have a sailboat, and I can't get up and down in the sailboat, and I can't go up the steps at home. So I said, well, are you driving very far? He said, oh, I'm coming quite a distance. I said, well, do yourself a favor and do some IV chelation while you're doing the EECP treatment. And he took my advice. About 3 months later, I had given him my card. He gave me a phone call, and he said, I want to thank you. He said, between those two things, he said, I can run up the steps. I said, boy, that's good to hear. And he said, I'm back in my sailboat. I have no trouble getting up and down, sailing the sailboat myself. And I said, well, that's been my experience with these modalities, so I'm glad to hear that. I always tell people, I tell friends of mine and other people I run into, do yourself the biggest favor you can do and go and see Dr. Courtney. He's a rare find. He's right here in Pittsburgh, and enjoy him while you have him, because you don't find doctors like this anyplace. Wow. I tell people, just avail yourself of this his wonderful modalities. There's so many things he can do to help people. All you have to do is call and show up.
All right, Emil. I guess I can expect you to say something like that. I want to thank you for those kind words. I want to thank you for sharing how these things have changed your life. I'm hoping that listeners out there may hear in you something that are going wrong with them and take it as a bonus to come on in to see us. I want to thank you for spending the morning with us. I'll be seeing you the next time you're in my office. I want to thank you so much, Emil, and look forward to seeing you and Rose and maybe that dog of yours sometime in the near future, all right?
I'll bring the dog over too, Doctor, and I might add that if any of your patients would like to talk to me directly about any of your modalities, they can reach me through your office. I'd be more than happy to talk to them and tell them any personal experiences with any of these modalities.
Thank you so much, Abel. Bye now.
Thank you, Doctor. Bye-bye.
All right. Okay, ladies and gentlemen, welcome back to the Weekend Wellness Workshop. We're coming up on the final few moments of this last segment, and sort of ready for a wrap-up of today. It was an interesting way to bring a very important concept of ours to you on how to optimize your blood flow to parts of your body that hasn't seen a blood flow in quite some time. And between these two modalities, number one, something called ECP, and another one, although it's a PEMF device, it's the Beemer. Between these two devices, we're seeing the potential, at least, to get you back and functioning again, no matter what disorder you may have. Now, of course, I came across the Beemer, at least, when it comes to the eye program, and I found out that ECP helps so much in people with the eye diseases that it's all in whatever package I'm working with. I'm trying to see how ECP and the Beemer could work in tandem to get you turned around also. If we're going to work on the plan, and the plan consists of correcting your deficiencies, which means diet, nutrition, and supplementation. Correcting your toxicities, which means find out what toxic substances you have on board. And the most important ones usually are things like the heavy metals, things like lead and mercury and cadmium and aluminum and antimony, and the list goes on and on and on. But these heavy metals weigh in and absolutely destroy the ability for cells to work optimally. So, especially with the diseases of aging, and in some cases, the diseases of young age, it's this combination of deficiencies and toxicities that literally have triggered the tripwire for you to experience the symptoms that you are experiencing. Now, as I had mentioned earlier, it's great to have doctors that are going to jump in, correct your diet, do you well with fixing your nutrition and getting you supplemented, and do wonderful things like IV chelation therapy to get your heavy metals gone. However, all of them go for naught if you don't have a mechanism by which to deliver the nutrients and to remove the toxic substances. So as I said earlier, and as I now reiterate, to deal with 2 of these 3 without dealing with the third means that you are going to be less than ideal when it's all over with. So if you're very big on your diet and your supplementation and you think you got that mastered, and you're also well aware of how to remove and get rid of heavy metals, you should be the very person that might want to come in and see us so that we can have a discussion about how we can correct your problem by doing the one thing that more than likely isn't going to be completed by the time you arrive, and that is optimizing your perfusion, optimizing your blood flow, and the use of ECP, as well as the Beemer is probably the best way to do it. Now, we are coming to right up to the top of the hour here. I enjoyed spending this Saturday with you. Don't forget, we'll have more on these as both of these as time moves on, and we'll be having more testimonials from others who are also experiencing the wonderful potential of developing their optimal perfusion. So I'm going to say so long to you now. Have a wonderful holiday. Look forward to seeing you next week. So until then, this is Dr. Dennis Courtney saying so long for the Weekend Wellness Workshop. See you soon. Bye now.